So now for body fat distribution, I mentioned earlier when I was talking about weight standards that it's not just the amount of fat you have, it's where the body fat is located that can influence health risk. So it's really important to assess body fat distribution. In fact, some health professionals think that it should be standard to measure a person's waist circumference to determine if they have that central distribution of body fat. So there's two fat depots in the body: subcutaneous fat under the skin, sub means under, cutaneous means the skin, and intra-abdominal fat, the fat inside the abdominal cavity. The intra-abdominal fat is contained in what is now a new organ. It just became organ status. It's called the omentum. The omentum is kind of like a sheet where fat collects in the intra-abdominal area, and it just received organ status a couple years ago. So the intra-abdominal fat, you can see that's the omentum there. Okay, and the subcutaneous body fat is underneath the skin. It tends to collect in larger amounts of subcutaneous body fat in the hips and thighs in a lot of people. So, lots of text on this slide. The intra-abdominal fat, if a person's fat is concentrated here, oftentimes they're called apple-shaped, and they're said to have an android body fat distribution. Android comes from the term androgen, which means male sex hormones. It's associated with a more male hormone profile, although many women have this body fat distribution. Some people with the apple-shaped body have, lean arms and legs, and most of their excess fat is concentrated in their intra-abdominal area. Some people with excessive intra-abdominal fat also have excess abdominal fat in the subcutaneous areas as well. So the apple-shaped is a little bit of a misnomer for some people. The intra-abdominal fat is highly active metabolically, whereas the subcutaneous body fat is really just a storage depot. So the intra-abdominal body fat, they say it's more easily lost than subcutaneous body fat, but people with that intra-abdominal fat depot may say otherwise. People who have type 2 diabetes tend to have that increased intra-abdominal fat, and people with type 2 diabetes actually do have a more difficult time losing weight than people without diabetes. The intra-abdominal fat is associated with increased health risks, including type 2 diabetes, heart disease, and gallstones. One of the reasons it's unhealthy is that this body fat actually secretes inflammatory substances. Okay, remember, inflammation is the underlying cause of a lot of different disease, and factors that impair insulin action. So the subcutaneous body fat is more of a storage depot, tends to collect in the hips and thighs, but other places as well. People with a lot of the subcutaneous body fat are often pear-shaped. It's called a gynoid distribution of body fat associated with female hormones. Although men can have gynoid obesity as well. So the subcutaneous body fat that tends to collect in the hips and thighs is more difficult to lose. It's resistant to weight loss. Some people think it's like the last resort reserve for survival, actually, in times of famine. But it's not as damaging health-wise as the intra-abdominal fat. But if you have a lot of subcutaneous body fat, it can still put a strain on your joints, and in way excess amounts, it can, make it more of a strain on your heart, especially upon exertion to move that extra body mass. So this is just an illustration of the apple-shaped versus the pear-shaped. And the way you determine if you're an apple or a pear is you measure your waist circumference. For men, if their waist circumference is more than 40 inches, that would mean they have excess abdominal fat and are at increased risk due to excess body fat. For women, if their waist circumference is greater than 35 inches, they're considered to have excess intra-abdominal fat and increased health risk. Some people, because tall people are just bigger than teeny tiny people, You know, somebody who is really, really, really tall, you know, like a basketball player, you would expect for them to have a larger waist than somebody who is average height. So some people prefer to use the cutoffs as waist circumference less than height in inches divided by 2. So I'm 5'4", actually 5'3 3/4", but I round up. So I'm 5'4", that's 64 inches. So my waist circumference should not be greater than 32 inches if I use that method. Now, there are genetic body types. If you look at your relatives, there's probably somebody whose body type you share. So you do inherit tendency for a particular body shape and composition. Okay. So the three main types of bodies are the mesomorph, who are naturally muscular. They tend to put on muscle pretty easily. Ectomorph, it's easier for them to get cut and say have the abs and all that. The ectomorph, naturally tall and thin with long limbs. Some of these people have difficulty gaining weight because they're naturally lean. They tend to have long arms and legs. Endomorphs, they're not necessarily overweight or obese, but they're softer. They tend to gain body fat easily. They tend to have difficulty getting like those cut muscles that some people strive for who lift weights in the gym. But you know, they can be healthy. This is one of the problems I have with all of the promotion of things like six packs, abs. Some people are just not built to have those. The same thing with really large muscle mass. Some people are genetically not designed to have, big, huge, bulging muscles. So this is a picture I found a long time ago of a mesomorph, an endomorph, and an ectomorph. It's a little bit hard to see the mesomorph's cut muscles in that outfit she's in. But these are three different genetic body types. This is a picture of an endomorph with excess body fat who's actually an elite athlete. She's one of those ultra endurance swimmers. So she's actually very fit. So are you doomed by your genetic body type? Not necessarily. I may or may not have told you this. Genes, load the gun and environment pulls the trigger. So your genes are influenced by your environment. So if you're an endomorph and lift weights and do cardio to increase lean tissue and decrease fat tissue, you can appear like a mesomorph. Some people it may be really, really difficult, but if you remember that guy that I showed you in the energy balance slides, the bodybuilder with the mullet, that friend of mine, he's actually an endomorph, but got really, really into weightlifting and got really, really careful about his diet. But do know that it can be really hard to fight genetic tendencies. Some people they call it genetic penetrance. Some people have a stronger genetic tendency than others, so it would be really hard for them to fight their natural body type. For example, I topped out at 5'4" almost, and no matter what I do, that's my genetic potential. I'm not going to be able to do anything to get taller than that. And for some people, the same thing with their body type. There's a genetic limit to what they can do. So that's the end of that. Next series will be on obesity.